Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So today we are going to deal with a very interesting topic, that is the definition, concept, philosophy as well as the objectives of nursing. So here, as we all know, that the nurses has been called as the oldest of the art and the youngest of the profession. This term nurses has been derived from a Latin word nutrix, which means to nourish or to cherish. Today, nursing has emerged as a learned profession that is both a science as well as an art. So now let's look on what is the definition of nursing. So according to Henderson, he has defined nursing as a unique function of a nurse to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery that he would do unaided if he had the necessary strength, will as well as power. So here, this Henderson has stated nursing as a unique function of a nurse. Why? Because here it is the nurse who will be providing care to the people who are not able to perform their daily activities or who are not well in order to help them recover from their condition. And also, these nurses will be assisting or will be helping the client in those activities which they would be doing if they had the necessary strength, will, or knowledge. There's one more definition which is given by Florence Nightingale. Here, according to her, she has stated nursing as the act of utilizing the environment of the patient in order to assist him in his recovery. So here, according to her, she states that nursing is the act of utilizing the environment in which the person lived in order to help him in his recovery state. Now, moving on to the concepts of nursing. Here, the art and science of modern nursing has encompasses the fundamental nursing concept that include the health, the illness, the stress, and the health promotion. Here, the nurses will be working with the physician and the other medical members in a wide variety of medical as well as the community settings. So what is the role of the nurse? Here, as we all know, that it is the nurse's role to provide preventive, primary, acute and chronic care for the sick and injured. So here the nurse will not only be providing care, but they'll also be providing health education whereby they can educate the people about the various factors that can affect their health. They'll also be providing the restorative care. They are the ones who will be administering medications to the patient, and they are also the one who will be providing the emergency care. So here, why do the nurse provide care? What is their main focus? Here, the main focus of the nurse is to protect as well as to promote both the physical as well as the mental health of the patient and of the whole community. So then, what is health? Why is this important? So, health is a state of complete physical, mental, social, and spiritual well being, and not merely absence of disease or infirmity. Health is the absence of illness, injury, and diseases. If the person is healthy, he or she will not be suffering from any kind of disease, he or she will not be ill, neither injured. Health as a fundamental nursing concept involves not only the physical well-being but also the physiological well-being. However, this will be changing from one person to another or through the person's lifetime. So, what is the role of the nurse in the healthcare settings? Here, it is the nurse's role in the healthcare settings to provide education to the client or to the family member or to the community as a whole about how to take care of themselves and also what are the various lifestyle changes and the behavioral changes which they can follow in order to promote their health. Here, not only the nurses will be providing education, but here they are also the one who will be providing care for the people and who will be helping them to recover from any kind of conditions they are suffering from. Now, what is illness? Why do one fall ill? Illness is a personal experience of being sick or unwell. Illness is a fundamental nursing concept that defines deviation from the normal health with three stages. The first one is the onset of illness. The second is the acceptance of the state of illness. And the third is the recovery, or the convalescent stage. So here, as I've said, that there are three stages. The onset of illness is the period when the person starts developing these diseases, or when the person starts feeling that he or she is not well. The second, which is the acceptance of the state of illness, here, the first stage, that is the onset of illness, is a stage when the person starts developing illness and when he starts feeling that he or she is not well. The second, which is the acceptance of the stage of illness, is the stage where a person will start accepting that he or she is ill. And the last one, which is the recovery stage, is the stage whereby the person will start to regain his health, will start to recover from his particular disease condition. So, what is the nurse's role when a patient is ill? Here, when the patient is ill, it is the nurse's role to monitor and also to interpret the symptoms. It is also their roles to administer medication as well as to provide health education to the patient and to the family members. It is also the nurse's role to provide care for the patient who are chronically ill, or for the patient who are unable to take care of themselves or to perform their daily activities. Here, for example, if a person is dehydrated because he's having the symptoms of fever and vomiting. So here it is very obvious that this person will not be able to perform his own activities because he will always be weak. So here it is the role of the nurse that she must take up the role of providing care to the patient and also to help him in various activities. She's also the one who will be providing medications as well as administering various intravenous fluid in order to help him to administering intravenous fluid so that he will not be suffering from severe dehydration. The next one here is stress. Here, when a patient is admitted to the hospital or when a patient is not well, he or she may suffer from stress. The nurses work to make the patient more comfortable, and a big part of the nursing care is to help them reduce their stress. So, here the nurses will be providing care for the people who are stressed because of their disease condition or because of their environment which they are in. Will help them to reduce their stress and will also help them to regain their normal health back as earlier as possible. So, what are the various things that a nurse can do in order to reduce the stress of the patient as well as of the family members? The first thing is she can explain the procedure to them before performing it. She needs to listen to them as well as she needs to clear their doubts and answer to their questions. She needs to protect the patient's privacy, and she also needs to maintain a good relationship with the patient as well as with the family members and ask them of how they are feeling. In this way, this will help the patient as well as the family member be at ease, where it would make them both physically as well as emotionally comfortable. Now, the next one here is the health promotion. It is very important that we as nurses must advise people on how to promote their health. Here, what can nurses do is they can be the ones who will be providing health education to the people of how to prevent as well as manage illnesses by following the safe lifestyle practices and also by indulging in the activities which would help them have a healthy life. So here what can nurses do is they can promote their health by discussing about their weight and the various exercises which they can perform in order to have a healthy life. They can also discuss about having a balanced nutritious food, and also we can advise them about what effects the smoking, drinking and drugs can lead them to cause from if they are addicted to these kinds of habits. By doing so, we can help them to improve their quality as well as the length of life. So here, now let's look on what are the various tasks a nurse needs to perform. The first one is to promote health. How? By providing health education on what are the various factors they should adopt to in order to improve their health, such as lifestyle modification, performance of exercises, and the second one is to prevent diseases. This can also be done through health education, where we will be educating the client about the various factors which they can adopt in order to prevent themselves from suffering from any kinds of diseases. The third one is to assist healing. This is usually given to the person who is already ill or injured. And the fourth one here is to ease suffering. Here we can assist the dying patient to pass away with peace and dignity. The next, it says that nursing is not only a science but also an art. Why is this said so? This is said because in order to be a good nurse, it is not only important that you should have a good theoretical knowledge, but it is also important on how you put these theoretical knowledge into practice. The client is a holistic human being, including both the suffering person as well as the healthy person. And the next one is that for a nurse, the working place is not only in the hospital, but also in the family, community, and the society as a whole. The nursing sciences attaches the human being as well as the environment in which he lives in, and the interrelationship between the human being and the environment. Moving on to the philosophy of nursing. Here, the philosophy of nursing is a statement which is sometimes written that declares a nurse's belief, values, and ethics regarding their care and treatment which they provide to the patient when they are in this profession. So, when we develop this personal philosophy of nursing, it will not only benefit our career but it will also benefit the client to whom we are providing this care for. So, as I've said, that this philosophy of nursing is a statement which is written that will include the nurse's belief, values, and ethics regarding their care and treatment which they would be providing to the patient when they are in this profession. So, if a nurse will be following these value, ethics, and belief in their profession, it will not only help them during their career, but it will also be helping the people for whom they're providing care. As we all know that the nurse is a crucial member of any healthcare team. Whenever we go to any hospitals, we also might have seen that there are many numbers of nurses present. Why is this so? This is because the nursing is a profession that can make a significant impact on the lives of many, because they are the ones who will be providing care to the patient and who will be there for them throughout. So, being in this position, there are certain qualities that a good nurse must have. That is the compassion, honesty, as well as respect. A nurse without compassion will only treat the diagnosis of the patient, but as we all know that the person health is not only made up of one but many other components. So, being able to empathize with the patient by building a good relationship, building a good rapport, and creating an environment which is inclusive of the physical, mental, and the emotional well being, this will help the patient to be at ease, and this will also help them to regain their health as fast as possible. The next one here is the honesty. Why do you think honesty is very important? Here, being a nurse, it is very important that we must be honest with whatever we say and whatever we do. By being honest, it will help us to build the credibility as well as the trust between the nurse and the patient. In this way, we will be able to collect more information about the patient, because these patients are more cooperative with the healthcare professionals that are deemed trustworthy. So here, if the patient trusts you, for sure he will be sharing everything with you without a doubt. The next one here is respect. If we give respect, then only we will get respect, right? So the same thing goes for a nurse and the patient. By being respectful to the patient, the nurses will get to know every information about them and also about their culture and beliefs, which will later on help them to formulate a good treatment plan, because here the patient will be always ready to cooperate with it and there will not be any stoppage in between. It is very important that each person must be treated as an individual and not as a diagnosis. So, if there is compassion, respect, honesty between the client and the nurse, this will help to create an environment that will optimize the health of the patient. So, here, what are the objectives of nursing? It is the nurse's role to maintain and to promote wellness, to prevent illness, as well as to provide care and rehabilitation for the sick and disabled through the human science of nursing. The second one is to reduce stress. Here it is very important that we as nurses must help the patients and the family members to reduce their stress by providing information, educating them, as well as clearing their doubts. The third one is providing comfort to the patient during their disease process. How can we provide comfort? Here we can provide comfort to them by being respectful, by being honest, by being compassionate, and by treating them as an individual and not as a diagnosis. As nurse, we can also provide various healthcare services to the patient, to the family members, as well as to the society. We as nurses must also try our best to build a good rapport with the patient, because in this way we will be able to get and to find out every little information about the patient. We as nurses must also work independently with other healthcare teams or other healthcare professionals in order to assist the client to gain their health, as well as to gain their independence as quick as possible. And the last one is to focus on a man living unity and also on a man qualitative participation with their experience. So these are the objectives of nursing. Now we have come to the end of this topic. In today's session, we have discussed about the definition of nurses, which was given by Henderson as well as by Florence Nightingale. We've also discussed about the concept of nursing and why this nursing is required. We've also discussed about illness, stress, and what is the role of a nurse here. We've also discussed about the various ways of how we can promote health, and also about the various tasks of nursing, philosophy of nursing, and the objectives of a nurse. So I hope you guys have got a clear insight of this topic. We will be meeting again in another session where we will be discussing about the various other topics of this particular subject. Till then, thank you. I will be meeting you guys in another session whereby I will be discussing about the furthermore topics of this particular subject. Thank you.